Hey guys, welcome to the Charm EMR video. This video is going to be to teach you how to navigate the Charm EMR system, as well as go through our charting process within the Charm EMR system. This video will cover logging in and the opening screen, viewing calendar and adding appointments, accessing and navigating a patient chart, viewing the welcome call flow sheet, entering and adding medications to a patient's list, viewing written orders in the document section, creating an encounter, previewing your charts, as well as locking your charts, and then unlocking a chart should you need to edit or change something, and then documenting a supply order sheet. So when you go to log into Charm Health, this is the screen that you will see to log in. You will enter your Finic Health email into this area here, and you will hit next. Then you will enter your password for that email, and then you will hit sign in. If you've already set this up, as far as the two-factor authentication, or you've logged in the past 180 days, you will not need to do this. But if this is your first time logging in, or it's past that 180 days, you will need to do the two-factor authentication, which this will send a text message to your cell phone, and you can utilize your personal cell phone number for your two-factor authentication. And this is where you'll put that message in so that you can continue into the EMR system. If it's been a while since you've logged in, you will need to create a new password, and this is how you will create that new password. In this case, I use Keychain to create the password for me, and you can do so on your iPads as well. Just utilize the Apple Keychain to create and store your passwords for you. That way, it'll allow you to use your fingerprint to log in the future. When you come to the two-factor authentication, you can go ahead and trust it. And again, it'll trust the browser that you're utilizing for 180 days. Please ensure that if you are trusting the browser that you're utilizing, that this is the iPad only that you are trusting, or your personal device that no one else accesses. Do not, and please ensure that you do not trust a public device when logging into Charm. Once you are logged in, this will be the main screen that comes up, and you will notice that there are several selections here. There's patients, calendar, chart notes, documents, messages, and tasks. We will go through all of these different areas throughout this video, but I always suggest you start with patients. And what this will do is lead you to your patient list. Notice when you get to your patient list section within the Charm EMR, there's several different areas within the screen. If you look over to the left here, we have mirroring sections that were on the initial opening screen. That's the calendar, chart notes, documents, messages, and tasks. In some cases, there may be multiple or additional areas within this section. And what you can do is, if you want it to mirror this, to be able to do that, you would hit customize. And you can turn sections on and off. In this case, we want all of these sections on so that we can see them. But if you log in and there are multiple sections in here, additional sections that are not these, you can turn those sections off. It just makes it cleaner and easier for you to see the information that you need. Then you would hit save. You have your main area here. This is where your patients will be listed for you. Then you'll also notice over here to add a patient. In this case, you will never need to add a patient. That will be done by a Finic Health Manager and added to your patient list for you. Here is a settings. And again, these are areas that you really don't need to mess with. It's something that we can't turn off and is hardwired into the Charm EMR, but you don't need to mess with it. If you have multiple patients that fill up this entire screen, then you can go up to this section and actually search for the patient that you're looking for, and it will bring your patient up. Now we are going to go into our calendar so that we can see our schedule for our patients and add or delete scheduled days for our patients. We'll go over to the left here and select calendar. This will bring us into our calendar section, and you'll notice that it always defaults to list view. When you are in list view, it will list all of your appointments for that day. I always go to month so that I can see the month calendar, which makes it easier for me to create and see my schedule. If you have appointments that have already been added to your schedule, you will see them on this calendar. In this case, this is a dummy account for demonstration purposes only. And right now I do not have any appointments on my calendar. You'll notice several different sections within this calendar screen. If you go up to your settings section, you'll be able to see that you can select providers or other RN schedules. This will allow you to see and coordinate with other nurses within the Finic Health team. Some nurses like to see everything and see all of the appointments. Some nurses only want to see their own, and some nurses only want to see their own with other nurses that they are coordinating patient care with. It is completely up to you on what you would like to see on your calendar. In this case, we are only going to select our dummy account so that we can see only our schedule. If you also notice below the settings section, there's an arrow forward and an arrow back. This will allow you to change the month view of your calendar. So the initial visit for any new start of care patient is initially scheduled by a nurse manager that completes the welcome call for that patient. Any subsequent visits must be scheduled by the primary nurse, and that allows the primary nurse to work with their patient and really select the days that best work for the nurse and work for the patient. Once you make subsequent visits or schedule subsequent visits, you need to add them to your calendar so that the entire team knows when that patient will be seen next. In this case, if we're going to start, say this patient is going to be seen on the June 26th. So we will select the date. It will bring up this screen. When you bring up the screen, we'll start at the top here. You'll see that the facility is Finic Health. This is an appointment, which won't change. It'll stay the same. Then we will select our patient. We'll put in dummy. So you can just type the initial name or the first name of your patient, and then it should bring up that patient in this list. Once you do that, you will have to select it. Make sure that it is the correct patient that you are attempting to select. For the provider, you will go ahead and select provider. In this case, it brings up all of the nurses that are contracted by Finic Health. Only select your name, or if you've already worked out a schedule with an additional nurse, only select that if you've already talked to that nurse and are making that appointment for the other nurse and they're already aware that you are making that appointment. Otherwise, only select yourself when you are making appointments. In this case, we're placeholder, so we're going to select placeholder. Status will always be confirmed. The visit type will always be a follow-up visit. The appointment mode is always going to be in person. This will, if it's a single day infusion, you would only select single date. If this is a multi-day infusion and you're going to be completing multiple days for that infusion, you can select period, which will allow you to select multiple days. In this case, we'll go ahead and select the bottom here, the end date. It always defaults to the month after the month that you are initially selecting. So in this case, it's defaulting to July, so we have to hit back to June. We'll start at June 26th, and then we'll say this is a 3-day infusion. So we'll select June 28th as the last infusion day. We'll put our time in. We'll say that this infusion is going to start at 9 a.m. And then our duration. A good rule of thumb for specifically IVIG is to always account for 1 hour per 10 grams of IVIG that is going to be administered. So in this case, we'll say that this is a 40-gram dose, and then we are going to do 240 minutes for that visit. This can vary from patient to patient and medication to medication. Just put a best guesstimate. It doesn't need to be exact. Always estimate more time than you think it's actually going to need. Reason, you don't need to put anything. And then message to the patient, you also don't need to touch or mess with. You will also not need to mess with anything on the right here. Once we have all of our information entered, you'll hit confirm. You'll see once we're done, it will add those visits to our calendar. Now say this patient wants to change their day 1 infusion to a different time. What you will do is you'll hover over the patient and you will click on that visit. It will bring up this screen and you will be able to either edit or cancel that appointment. What you're going to do is you're going to hit edit in this case because we're going to change the time. Once you do that, you can go ahead and come down to the time. You can select a different time. Say the patient wants to start at 10 instead of 9. We'll select 10 a.m. and then we will hit confirm. You can see here that the time was changed on our calendar. The nice thing about adding these visits to the Charm calendar is that this calendar directly connects to your Google account that you created with your Finic Health email. So when you go into your Google Calendar, you will see these visits on your Google Calendar. Also, anytime a change is made on the schedule, Charm will automatically send an email update to your Finic Health email alerting you that a change has been made. Now say for whatever reason this patient needs to be canceled because they are no longer on service with us. What you'll do is you'll actually select day 1 and you'll see that it brings up the screen again. Instead of hitting edit, we're going to hit cancel appointment. When you hit cancel appointment, you'll see that you'll be able to either cancel that day only or cancel that entire period that we created. It will also request a reason for the cancellation. In this case, we're going to put testing, but you would put whatever reason it is that you are canceling that appointment for. Once you're done there, you're going to hit confirm. Then you'll see that it has removed it from our calendar. Once it's removed it from our calendar, Charm will go ahead and send you a email reminder or email update that those visits have been canceled. Again, to recap this process, You will be, anytime you schedule subsequent visits with your patient, you will be adding those visits onto the calendar. You will be always updating those visits if the patient changes time or if they're changing dates. You will always make sure that your calendar within Charm Health is reflective of your actual visit times and dates for that patient. Now, we are going to go into accessing and navigating a patient's chart. So if you come back over to the left side here, you will hit Patients, which will bring up our patient list. So you will select the patient that you want to view. When you initially open a chart, if there's an alert for that patient, it will pop up first. Alerts are for providing information to any nurse that will go into that patient's home. In this case, you can see that it is listed that the patient has an aggressive dog. But really, any information that is pertinent to that patient or that visit will be in the alert screen. Please read the alert, and once you understand it, acknowledge the alert by hitting Got It. Once you clear your alert screen, you will then be in the patient's chart. You will notice that there are several different sections within this chart. On the left-hand screen, these are the different tabs within our chart that allows us to navigate to different sections within the chart. You'll notice that there's a Customize tab at the bottom here. If this is your first time signing into Charm or first time utilizing Charm, you will have several different selections on this left-hand column that you do not need. So please go into Customize, and this will allow you to select which tabs you want to see and you don't want to see. Please make your tabs selection mirror this image. To select or deselect a tab, you will click on that tab till it is no longer highlighted in green. To add a tab, you will click on it again until it is green. Once you have deselected all of your correct tabs, hit Save. Again, it'll bring up the alert screen, hit Got It, and then you'll notice that your list on the left-hand side here has gotten much shorter. This will make it easier for you to navigate only the tabs that you need to take care of your patient. Once that's done, you'll notice at the top here, you'll have your patient name, their MRN, as well as their date of birth and phone number. You'll notice that there's an allergy screen, their last and next visit, and then their weight and BMI. On the dashboard tab, you'll notice that there are several selections at the top here. The only selections that you will need is your face sheet, which it defaults to, and your flow sheet. On a face sheet, it's just like a face sheet in the hospital. It's a snapshot of that patient and all of the information that's been recorded on them. If this is a new patient, this will be relatively empty and there will be no information. If this is a patient that's been on service for a while, these different sections will be filled out. Moving over to your flow sheet, you'll select flow sheet. This will bring up our welcome call assessment. Every new patient receives a welcome call assessment. The welcome call assessment goes over several different areas with that patient. And it goes over several different areas of information that will be very helpful to you as a primary nurse walking into that patient's first visit. Some things to highlight here are if the patient is a hard stick. Do they have any issues with hypertension? Any other kind of concerns or anything that they have with their visit? This is a good section to start to review so that you can see what was answered by that patient within the welcome call. The other tabs on top here, you do not need to mess with. The next tab here is the patient details. This will give you your patient's name, their address, phone number, any emergency contacts, and also any other pertinent information that you will need to know about your patient. We will skip encounters and we'll go into diagnosis. Right now, this dummy patient doesn't have a diagnosis listed, but every patient will have their diagnosis listed here. Our next tab is going to be the medications tab. Here you will see all of the active medications for that patient. If this is your first time seeing the patient and they are a new patient to Finic Health, this section must be filled out and their daily medications must be reconciled. To add a medication, you will select plus medications on the right hand here. Do not select plus prescriptions or reconcile, only plus medications. You'll select that and then you'll just add their med list. What you will do is you will begin to type the medication, and you do not need to type the full name of the medication, only the beginning of that medication. You'll hit enter. Once you search your medication, it will bring up a long list of medications. To narrow this list down, you can select the strength of the particular medication that you are looking for. In this case, we're looking for metoprolol 25 milligrams. This will narrow your list down significantly and allow it to be much easier for you to find the medication that you are looking to add. Once you have found the medication that you are looking to add to that patient's medication list, you will hit add. In this screen, you will have a directions box, and this is where you will put the directions or the prescription for that medication. In this case, the patient takes metoprolol 25 milligrams once daily. So we will put you do not need to put a start date or an end date. Once that's completed, you will hit add. Say we need to delete a medication. If this is, say we entered it by mistake and it's not even the correct medication that we were looking for, we would go ahead and hit the little trash can, which will delete it off the list. Say the patient has a change to their medication and they are no longer on that medication, but they were actually taking it. We will go ahead and hit next to active, we will hit the arrow and we'll have a selection between active and inactive. If the patient is no longer taking this medication, we will not delete it. We will take it from active and then change it to inactive. The next tab on the left here is allergies. Allergies are very similar to the medications tab and how we add, delete, or change. If we need to add an allergy, you'll go ahead and hit plus allergies. And then we will be able to add the medication that the patient is allergic to. You'll select that the medication, it's a medication allergy. They're allergic to penicillin. It's severe. You don't have to put observed on. You want to say active, and then you want to list what the reaction is. Then we will hit add. Say we have entered this medication by mistake, we will go ahead and hit the delete. If we need to edit this allergy, we can go ahead and hit the little pen, hit edit. It'll bring up the medication. You can edit what you need to edit and then hit save. And then you're good to go. I always recommend and I always suggest that when you get a new starter care patient and you are entering the medications and the allergies, you enter the medications and the allergies prior to creating your encounter, which we will go into in a little bit here. But always do your medication and allergies first. Reason being is it automatically transitions those medications and allergies into your chart. So you don't need to double your work as far as recording those medications and allergies. The next tab here is your documents. This is a very important section, and this is where the written order from the physician will be stored. and this will be the actual order that the physician signed. You'll see it listed and labeled here. What you will do is you'll go into the tab, you'll see your order, you'll go ahead and select it, and then it'll bring up an actual PDF of the actual order that is signed by that physician. Again, this is just an example. This is not actually an order, but when you are looking at these orders, it's very, very important that you understand them. The written order is what we as RNs are working under with our licenses and how we can do this legally. So we cannot do anything that is outside the scope of that order. So it is very important that you review this order, understand the order, and if you have any questions on that order, that you reach out to a nurse manager prior to seeing that patient. To close this box, you will hit the X. If there's multiple orders in here or really anything that is pertinent to this patient that comes from the pharmacy directly, it will be uploaded here for you to review. Messages, we don't utilize at this time, but it's a tab that I want you to have because we may utilize it in the future. Tasks, same thing, we don't utilize at this time, but we may utilize it in the future. Please keep that tab available. Alerts, if there's anything that you notice in the patient's home that you will need or that you think a nurse would need to know, you can go ahead and add the alerts into this screen. If an alert is no longer relevant to that patient, like it's a task or something that we were requested from you, you can go ahead and go in here and delete that alert. Or you can go ahead and add the alert as needed. Quick notes is going to be a way for us to communicate to the team. So anytime, say, a patient changes their schedule or changes their date, or really any interaction that with that patient is where you'll put in the quick notes. The quick notes is a way to chart without it actually being attached to the chart, the patient's legal chart that will go to the pharmacy. This is more of a section that allows us to communicate as a team. Okay, now we're going to go into the encounters tab. This is where all of your charting is actually going to take place. You'll see in this case, there are no encounters for this patient yet. Think of an encounter as an actual chart. So every new encounter is going to be in a chart for that patient. Every visit will require a new encounter. To create a new encounter, you will come up here to the top and select plus encounter. The facility is always going to be Finic Health. It's going to be your name. In this case, our name is placeholder, so it's going to be the provider's name, the date of that visit, and then the visit type. You will always select follow-up visit. The encounter mode will always be defaulted to in-person, and you will always leave it as in-person. Then you will hit create. When you hit create, sometimes it does take a little bit, so give it a chance to load because it can move kind of slow. You'll see that you have this section over here that opens immediately when you open or create a new encounter. Go ahead and close that section, which will create and open up a full screen view of that encounter. Now, when you create an encounter, it will automatically default with an infusion chart practice template. Every encounter contains templates. And think of templates as the building block of your chart. There are multiple different templates for each patient situation. If you notice at the top here, there's a little red one. Every time you create a new encounter, it will default with one template, which is the infusion chart practice, which is what will be used to create a chart on every patient every time. If you select the little red one, you'll see that it lists the infusion chart practice. So in this case, it already is preloaded with that infusion chart practice. There is a template protocol that lists every template that needs to be listed in an encounter based off of that patient and the visit type. To add a template, you will select the search bar, and then again, you will select the template that is appropriate for what it is that you are attempting to chart for that patient. In this case, we're going to say this is an initial visit, and it's the day 1 visit. So we're going to do an infusion chart practice as well as our 485 form. But you'll notice that there are several different templates listed here, and you will select the template that is appropriate for the situation and the charting situation that you are charting on that patient. So in this case, we're going to select the 485 form practice. Now you'll notice over here, the little red 1 turned into a little red 2. If you click on that, you'll see now that the template has been added to our encounter or our chart. If you accidentally add the wrong template and you need to delete it, you would hit the little trash can and it will delete that template for you. So once we build our encounter with our templates or build our chart with our templates, then we can go ahead and go in to start charting. At the top here, you'll see chief complaints. We do not chart anything in this box. This box is here because we cannot take it away. It's hardwired into the system. Then you'll notice our vital signs section. This section is going to be for your through the door vital signs. So this is the vital signs that we immediately take before we do anything else to that patient. Our on-site time is going to be the time that you clock into from ADP. Your off-site time is going to be the time that you clock out in ADP, and they need to match perfectly. If they do not match, a nurse manager or a manager will be reaching out to you to adjust or have you adjust those times on your chart. If we ever have to drop off labs, we will record the time that you arrive to the lab and then the time that you leave the lab after you drop off those labs. It doesn't happen often, but if it does, this is where we record those times to make sure that you get paid for it. Then you'll see the pre-infusion checklist. The pre-infusion checklist is very important because these are the different areas that we need to address before we touch or open our medication. If any of these factors are not met, we cannot open that medication. Again, this medication is very expensive, so we want to make sure that the patient is appropriate to be infused that day and that we can get that IV started and that we meet all of these criteria prior to opening that medication. They are just check boxes, so you'll go ahead and check everything that is relevant. When we are starting IV access, you only get 3 attempts before you can no longer poke that patient. If you get access within 3 attempts, you can go ahead and just check this. If for some reason you poke the patient 3 times and are unable to obtain access, you would check this and then document that you contacted your nurse manager. Again, we do our through the door vital signs, and then we will make sure that those vital signs meet our protocol and are within normal limits to be able to begin administration of that medication. If for some reason that patient's vital signs are out of normal limits and we cannot administer that medication, we will go ahead and check this and then document that we contacted our nurse manager. In this case, we're not going to check that. We also want to make sure that our ANA kit is on site and not expired. And this is before we open our medication. So if once we've done that, we've checked our ANA kit and then we made sure that it's not expired, we'll go ahead and check that. If this is the first time you've seen this patient, I ask that all nurses wear a mask until the patient says that it's okay for them not to wear a mask. If you wore a mask, you can go ahead and check it. If you did not wear a mask and the patient's okay without you wearing a mask, then you do not have to check those sections. Same with the patient being masked themselves. We always wash our hands with soap and water prior to starting patient care. So we're gonna go ahead and check that. This next section here is gonna be where we record the expiration date of the epinephrine within the anaphylactic kit. Then we will record the expiration date of the IV Benadryl that is also within the anaphylactic kit. If there are any additional medications within that anaphylactic kit, you will go ahead and list them and the expiration dates in this section. If there are none, you'll go ahead and put NA. We will also list our next infusion date. If this is a multi-day infusion, say this is day 1 of 5, we would go ahead and put the next infusion date, which would be tomorrow. So say we're doing this on the 1st, or day 2 of the infusion will be the next day, we will put the 2nd. So say it's 6/1 is our initiation, we'll put 6/2 for our next infusion date. If it's the last day of the infusion, say on 6/2 is our last day and they're not gonna infuse again until 4 weeks, then we would put that 4-week next infusion date in here. If there are any changes to their medication list, we would go ahead and select yes, and then we would list that change that happened with that medication. If this is a new start patient, we will say yes, and then put med list updated. If this is a already established patient and none of their medications have changed, you can go ahead and just select no. You'll also see that the medications are listed here within the encounter. This is why I always suggest you do your med rec of their daily medications prior to creating your encounter, because you can see here that it automatically pulled our daily medications from our med list into our chart. The next section here is, did they have any significant changes in their weight? Really what we're looking for is plus or minus 10 pounds. If the patient was dieting and attempting to lose weight, then we will note that in our chart. But if the patient has a wild swing and they did not attempt to try to lose weight, we also want to note that so that we can let the pharmacy and the physician know. Also, most of these medications, if not all of these medications, are weight-based. So if they have a significant change in their weight, we need to make sure the pharmacy is alerted so that they can adjust those medications based off of their current weight. If you are not seeing a pediatric patient, you do not need to worry about this. You will hit NA. If you are seeing a pediatric patient, you will hit yes, and then put in the weight, standing weight that you obtained from that visit. In this section, you will document or make sure that they don't have any additional changes within their allergies. In this case, we'll say no. You'll also notice that their allergy list has been automatically added to this encounter. So again, this is why it's very important for you to fill out those medication and allergy tabs prior to creating your encounter for new starter care patients. It saves you a lot of work. Then we will head into our head to toe assessment. You will have your pain section. If they are having any pain, you will list the pain and describe and how they describe it. You'll see that there are pre-populated responses for each section. If you agree with that pre-populated response and the patient fits within that statement, you can go ahead and just select it. If there's any additions you need to make, you can add a comment in here. If for some reason that patient does not fit within that statement, you can go ahead and hit other, and then go ahead and document in the comments below what is going on with that patient. In this case, we're going to say this is a normal assessment, so we're going to go through and select all of our pre-populated responses for this patient. Just please make sure that when you select these pre-populated responses, that they correlate to the actual assessment of that patient. If for some reason the patient does not fit or does not meet that pre-populated response, go ahead and select other and then document what you are seeing with your patient. Then we will go into the general notes section. The general notes section is for any narrative charting. There is no limit to how much you can chart in the general notes section. So anything that is overflow, or say you encounter an issue or a problem, this is where you would document that. If this is a normal patient and there's no need or additions that you need to add to your chart, you do not need to fill out anything in the note section. It is only an overflow area that you will utilize to document information that you can't document elsewhere within the chart, or if you encounter some type of an issue with that patient and you need to document a narrative note, this is where you would do that. Your pre and post medications, this is where you will document that. When you document pre and post medications, these are the medications that are listed on the PDF order that is within the Documents tab. We as nurses cannot administer anything that is not on our written order. This section is where we will list the infused medication. So this is going to be in a case of IVIG. This is where we would list the actual name of the IVIG. Then we will list the dose. So in this case, we'll say this patient is on 40 grams. And say this is a multi-day infusion. Say this is day 3 of 5. We would put day, then 3/5. If this is a single day infusion, then we would just list the grams for that infusion. Frequency is going to be how often we are going to administer that dose. So if this patient is a 5-day infusion, Q 3 weeks, 4 weeks, then this is where we would put that. The vial number, this is where you're gonna put, so every medication that's sent from pharmacy has a lot and expiration date. Not every vial that they send is gonna be the same lot and expiration date. If all of the vials are the same lot and expiration date, you only have to list one lot and expiration for all the vials. So in this case, you would put, say all the vials are the same, you would put 1 through 4 vials has this lot and this expiration. Say there were multiple vials and multiple different lots and expirations. In this case, we'll say that there was 2 different vials types with 2 different lot and expirations. 4 of the vials had this lot and expiration, and then 1 vial had this lot and expiration. Then you would put 1 and then that lot and expiration. If they're all the same lot and expiration though, you do not need to list the same lot and expiration 4 times. You simply have to put 1 through 4, then the lot and expiration. Now we're heading into our IV section. You'll notice that there's multiple selections up here. There's PIV, implanted port, PIC, and sub-Q infusion. Go ahead and select the one that is appropriate for you. In this case, we're going to put the needle size and the length that we utilized for that patient. We did get blood return because it is a good IV. Then we will put the site that we started that PIV. We will put the date that that PIV was placed. For venous access, this is either going to be a new start or it was started on a prior infusion day. For multi-day infusions, we can leave a PIV in place for that multi-day infusion, up to 5 days if the patient's PIV lasts that long. In this case, it's going to be a new start. If it was started on prior infusion day, we would select that option. If this was a sub-Q infusion, we would select that option. Since this is a new start, our dressing is clean, dry, intact. Infusion device flush as well. There is no redness or swelling noted, and blood return was noted. If this was started on a prior infusion day, we would go ahead and select all the responses that correlate to what we are observing with that patient that day. If this is a sub-Q infusion, we would go ahead and hit NA. We'll go ahead and put in how many attempts we made to start that at PIV. And again, if you poke a patient 3 times, you cannot poke any more than that. You will need to contact a nurse manager after your 3rd failed attempt, and then we would go from there. And hopefully either we would reschedule that patient or we would have another nurse come out and attempt to start access. If this was started on a prior infusion day, you would go ahead and hit NA. The technique used is always going to be aseptic. Unless we are accessing an implanted port, then it would be a sterile procedure. If it was started on a prior infusion day, you would hit NA. If this PIV was left in place for a multi-day infusion, you would go ahead and hit yes. If that PIV was removed the same day, you can go ahead and hit no. You'll notice that at the end here, it's for post-infusion, and those correlate to the selection that you made at the top, whether it be PIV, implanted port, PIC, or sub-Q. You'll notice to the right, there are checkboxed selections for each section, depending on the access that we obtained. You will select the option that correlates best to how you manage that PIV at the post of an infusion. If it was left in for just that infusion, then you would go ahead and check mark that the PIV was flushed with normal saline and then removed intact and bleeding was controlled. If that PIV was left in for multi-day infusion, then you would go ahead and select the options that correlate to what you did. If there's anything in here that is not pre-populated and it's not a checkbox, you can go ahead and hit other and then document what you need to document. If this was, say, an implanted port, you would do the same thing and leave the PIV blank. In this case, since this is a PIV, we're going to go ahead and document under PIV and leave the other sections blank. Since we removed our PIV today, we're going to document the same date that we documented before. If this was a PIV that was left in for a multi-day infusion, we would go ahead and document the date that it was placed, and then say this was the last day that we were going to utilize it. Say, our day 1 was on 6/21, and then we have done our 5 days, and we are then removing that PIV on 6/26. We would document 6/26. Any venous notes that you need to add, you can add here. For multi-day infusions, I typically document how I secured that PIV and then wrapped that PIV for the next day's infusion, I would document that here. If there were labs drawn, you would go ahead and select that response, yes or no. If yes, then you would document where you took those labs, whether it be FedEx or to the actual lab to be processed. The infusion start time, this is going to be the time that we actually started the medication. This does not include IV hydration or any pre-meds. This is strictly when we actually start the medication. The end time will be the time that the actual medication ends and the infusion is finished. We also document everything in military time. Your first vital sign here is going to be when you actually started that infusion. And then this would be the second set of vital signs that we obtained. We get a through the door vital signs, then we get a vital signs when we actually start the medication. This is where you will put that second set of vital signs. In the notes section, you will put a brief description of what you're seeing with that patient. It doesn't need to be super involved, but basically with this note section, we want to paint a picture of a stable patient at that time when we took those vital signs. To follow the vital signs protocol outlined by Finic Health, we will do vital signs Q15 for the first hour, then 30 minutes for an hour, then hourly after that. So when we titrate with IVIG, we typically are always going to titrate every 30 minutes. Every time we titrate a medication, we need to get a set of vital signs. To follow the Finic Health vital signs protocol, we are going to do vital signs every 15 minutes for the first hour, then every 30 minutes for 1 hour, and then hourly after that. When you are documenting these vital signs in this chart, it makes it much easier for you to get the correct times if you document your titration intervals first. So in this case, we started at 0900. We're going to titrate 4 times, going up by 25 mLs every 30 minutes. So we want to skip a line because this will be our first 15-minute vital sign. This will be our first titration. So we're going to put 0930. Then we're going to skip a line and put 1000. And then we will go back and put in our 15-minute vital sign, which is going to be 0915. Then our titration in, which will be the 0930. And then our last 15-minute vital sign, which will be 0945. We'll put in another 15-minute vital sign because we're going to titrate at 1000. You always have to document a vital sign when you titrate. So by doing this, we're making sure that we document the correct time when we actually titrated that medication. So I'll go back and put in my actual rates when we titrated and what we titrated up to. And then in this case, because it's the 15-minute vital sign, they'll still be the same as the initial titration. But what this does by doing it this way is it makes it so that our titration times are correct, because we need to titrate every 30 minutes. And this is how we document that we actually titrated every 30 minutes. So it's easier and allows you to not accidentally document a titration time that doesn't correlate correctly when you're doing 15-minute vital signs. Once you have that documented and filled out, then you can kind of go into the additional protocol, which would be, again, 30 minutes, 1100, and then you can do 1200 going forward. But I've seen multiple nurses make mistakes with trying to document 15-minute vital signs and just documenting them one after the another and not doing or following this process. At the bottom here, this will be a sign off, or essentially after we are done with our infusion. This is basically saying that when we left that patient's home, that patient was stable and safe to be left alone or in the hands of a caregiver. That is the end of our infusion chart practice template, is right here. This section is the start of our 485 form template. And you'll notice that the allergies and the medications are again pulled from the allergy and medication tabs into our chart. Think of the 485 form as a nursing care plan. We're documenting a clear picture of that patient and documenting how they are progressing on therapy. So you'll go ahead and just go through all of the different sections and select the selections that are appropriate. If for whatever reason something doesn't correlate to the patient that you are seeing, go ahead and document in the comment section. The patient goals, we will always select goals for this patient as far as what we hope to achieve with our visit. Go ahead and select the goals that correlate to your patient. If any of these goals do not fit your patient, or you need to add additional goals that are customized for your patient, go ahead and place them here in the comment section. This last section here is going to be an update on the patient's progress on therapy. If this is a start of care patient and they've never received drug before, you'll go ahead and select NA start of care visit. Otherwise, you will always select one of these other three options or other and then document. Again, this is where we're going to document how well that patient is progressing on their therapy. Or if the patient is just managed and there's no changes from month to month, you'll go ahead and select that. At the bottom here, this is going to be your round trip mileage. So this is your round trip mileage from your home to the patient's home and from the patient's home back to your home. As you're going through your charting process, you always want to get in the habit of hitting save. When you hit save, you'll notice that it says data saved successfully. If you ever hit that save button and you do not see that green data saved successfully prompt, expect that whatever you charted will most likely not be saved. So if that's the case, write everything down, and then once you go out of the screen or have to refresh your screen, you may have to go back and rechart. So get in the habit of always, as you go, hitting save, because then once you see that, your charting will be saved to that point. You will also notice at the top here, there's a preview button. Once your charting is complete and you want to review your charting, you can go ahead and hit preview. Preview will bring up a essentially printout of what that chart will look like when we send it to the pharmacy. This section just makes it much easier to review your chart and make sure that everything is accurate and that you did not skip or are missing anything within your chart. So once you scroll through your chart and make sure that everything is accurate in the way that you want it, you will go ahead and close your preview, and then you are ready to sign your chart. Go ahead and hit sign. It will say once signed, you cannot edit this encounter. Do you want to continue? Hit yes or okay. And then you'll note that your chart is signed. This is a digital signature for you as an RN with that chart. Nobody can change, alter, or edit that chart after you sign it. If for some reason you do need to go in, you forgot something, so we forgot our in and out times, what you can do is you will go to the encounters, you'll go to all, and when you go to all, you'll see all the encounters that have been created for that patient. You'll go ahead and select the encounter that you need to edit. It'll bring it up, and you'll notice at the top here it says unlock. You can go ahead and unlock your chart. The only thing is when you unlock your chart, it will make you document a reason why you are unlocking that chart. You must put whatever it is that you are doing or why you are unlocking that chart. In this case, we forgot our in and out times. Then you will hit OK. When you do that, it creates an addendum to that chart and will forever be attached to it. So please keep your documentation concise, objective, and to the point when you are documenting why you are unlocking your charts. You'll see that this panel opens again. You can go ahead and close that. Now you will be able to make edits to your chart. And then you can go ahead and hit sign again. The last date of every visit will need to have a supply sheet order form created for that patient for their next visit. This will allow us to request all of the supplies that we will need for that patient on their next visit. When you create a supply sheet, it needs to be separate from the actual chart. And you cannot add the supply sheet in the same encounter as the chart. So to create a supply sheet, you will actually create a new encounter that is separate from the actual patient's chart. To do this, you will go into the encounter section. You will create a new encounter. Now the computer is telling us that there already is an encounter created, because we have the encounter open for the patient's initial chart. We'll go ahead and say, no, it's okay. I want to continue because I want to create a new encounter. When you create a supply sheet encounter, or when you're documenting a supply sheet within an encounter, the visit type will be left blank. When you hit the drop-down button, remember we have the follow-up visit that we would normally select if we were creating a patient chart. When you are doing a supply sheet, you will not select anything, you will keep it blank. Then you will hit create. Again, it runs slow and it may take a minute for it to open. You'll close this tab. You'll notice that there's a little red 1 up here again. In this case, what we will do is we will go and click on the little red 1, and then we will delete our infusion chart practice template. Then you will notice that there is nothing in this chart. There are no templates within this chart. Then we must add our supply sheet template. So you will go to the search bar, you'll click in the search bar, and you will select supply list practice. When you select supply list practice, it adds the supply list template, which will allow you to inventory the supplies that are in the home and then allow you to add the quantity of supplies that you need for your next infusion. You will notice that there are pre-populated supplies on this sheet. These are 95% of the supplies that you will ever need. If you need anything that is outside of these supplies or that is not listed within this supply sheet, please go to nursing requests and then chart a narrative or a sentence or two on whatever supplies it is that you will need for that next visit. Just because we request supplies does not mean that we will always get it, especially if it is a custom request. But please, if it will help you in your patient care and you feel the patient is appropriate for that supply, please add it onto your supply sheet. Once you have filled out your supply sheet, you will go ahead and hit sign, and then sign that encounter like you would any other encounter. Now we are in the encounters tab. You'll see that it has one unsigned encounter from the chart that I need to finish. But if we go to all, we can see that there are two encounters in here. We have our one that is signed, which was our supply sheet, and then we have our actual chart that is still not done yet. If this is a very well-established patient and they have been on service with us for a while, you can go to all and go back and look at multiple charts that have been created for that patient. This will allow you to read other RNs charting or your past charting to review any infusion rates or any additional charting that you need to review on that patient that has been created within our charting system. Hey guys, we're coming to a close of this video. Thank you for bearing with me and getting through this initial introduction to Charm Health EMR charting system for Finic Health. I will say this was a lot of information and I do not expect you to retain everything that you've learned from this video. I will say that you will go over this information several different times in person with your nurse educator. This will be done in your one-on-one teaching session, as well as when you do your joint visits with your nurse educator. If you have any questions, please reach out to any of the support staff or your direct manager, especially when you're going through this process, because we want you to be successful in going through this charting system. There is no such thing as a dumb question, and we are always there to help you and support you through your learning process. Thank you very much for choosing to work with Finic Health, and I'm very excited to have you aboard with us.